COVID-19. I am joined here with our city council members who are in the back to make sure that everyone understands that we've got full support for what is going to happen in this city and our ability to manage and control the COVID. I am also joined by the city leadership, all standing behind me, and many of them will speak today regarding their actions and their policies in an attempt to stop the spread. The numbers tell the story. We have gotten too comfortable and we have gone back to living our lives as if COVID-19 did not exist. The numbers tell us that COVID-19 is in our community and is spreading rapidly. This community has the ability to stop the spread if each one of us choose to be a part of the solution. It is in our hands. It is in your hands. If you care about your family, your friends, your neighbors, your fellow citizens in this city, as well as the business owners in this city, then you have a part to play in helping to stop the spread of COVID-19. West Texans have always stood strong, stood tall, and stood together. We've always been there to support our neighbors when we needed to. If we choose to work together, we can change the numbers. If we all support each other, we can change the trend. The answers to how are simple and do not really require much from each of us. You know what they are. You know what the health CDC protocols have been. The messaging has been consistent. The messaging has not changed. And you've heard it so many times that I don't think you need me to repeat the messaging. Most importantly right now, what we're asking people to do is to avoid large gatherings. We believe strongly that the biggest problem we have today is we've gotten too comfortable and we're choosing to socialize way too much. It comes down to this: respect, responsibility, support the businesses who are enforcing the CDC guidelines. Business owners should not be put in a position of enforcement, but unfortunately, we need our business owners to be a part of helping us control the spread. We do not need the governor to tell us what to do in San Angelo. We know what to do. We just need to do it. Avoid large gatherings. You know the rest of the story. Respect, responsibility. It is in your hands. It is each of our responsibilities to help stop the spread. Respect your healthcare workers. They are being pushed to the limit. Spread is happening in our backyards, our living rooms, in our homes, and in our lives without knowing it because there are so many asymptomatic people. We stand here today as a united group. Citizens, we need you to stand united in helping our city stop the community spread. We need our citizens to stand West Texas strong. Yes, of course, the majority of the positive cases do not require hospitalizations. And yes, the majority of the positive cases will not have long-lasting health consequences. But those who have been impacted have suffered financially, emotionally, mentally, and have had tough decisions to make as it requires to their income for their families. But the reality is, the more positive cases we have, the more hospitalizations will happen. Businesses have had to close, not because the governor has chosen to shut them down, but because they've had so many employees test positive, they have to close their doors. I ask you to join me and the rest of our city leadership and our city council to help us be a city that stands tall and shows other cities how to stop the community spread. I will now ask Judge Floyd to please come forward and offer comments.
Thank you, Mayor. Also, it has been very encouraging to me the last 6 or 8 weeks to move around this community and see it fully open and functional, events going on, bars open, restaurants at more of capacity. I need to make it clear that that ability to do that rests solely in my office as the county judge as per the governor's orders. And that allowance to allow me to request that attestation that we're below 15% hospitalization of COVID patients relative to the number of beds. If we exceed that, and we're getting extremely close, then under that order, I lose any authority and we will lose that attestation. Bars go back to being closed and restaurants go back. That's the last thing that I want to see happen. During the course of this, we have discussed it daily now for 7 or 8 months. We started the spring as being in this chamber, I think on March the 19th, and here we are still trying to deal with it. Probably faced with more of a challenge now. We know more about it, but we do know the flu season's coming and winter's coming. So we have a challenge on our hands. We have not been able to determine the source of where our numbers are growing. I think if you look at the demographics, you'll figure out that there's no single source. But I'm sure all of you have noticed the same thing that I have observed. I think everybody in this room has observed. You've gone to businesses or events that there's not much compliance going on. And I think that's crucial now. I think we owe it to the businesses that are open, that we want them to remain open. We owe it to our partners that are standing back there that's trying to run the public education system, higher education, our hospital systems, our Howard College, the Goodfellow Air Force Base, everything that's crucial to our quality of life here. And I believe that we owe it to them. So I'm going to announce a new program that we're going to come up with that's the best idea in conjunction with the city to try to take the steps that we can to try to encourage and gain compliance for those that are not doing such a good job, whether they're a business owner or whoever's sponsoring some type of a special event. I've approved a great number of events out in the county. Dr. VRETIS has approved a number of events within the county, and we have sporadic compliance with that. And we believe possibly that's probably what's contributed to our growth numbers. So going forward, we will have some compliance officers that will be checking on various businesses and those events as they occur. They're there to not do anything but to assist whoever the proprietors or whoever the sponsors are on the events to convince their patrons, participants, customers, or whoever they are to comply with at least the distancing guidelines. You know, the mask has been very controversial, but at this point in time, there's enough positive situations that the mask needs to be worn, especially if you cannot maintain somehow separation. I think we owe it to the community, we owe it to ourselves to take the last step that we can to try to at least flatten this thing out some to keep us from reaching that 15%. Because if that happens, the mayor really, after the governor's orders, had really no authority within this. All of this rested with me. If we go over the 15%, my discretion in that is gone. It's handed to the governors, and at that point in time, Dr. VRETIS, that's standing behind me, has all the power, and his power basically is to shut down businesses and events individually. So we're hoping that this helps the whole community address this, to give them the support, and hopefully if anybody gets punished out of this, it's only the ones that choose not to comply. Those are doing good business. Our goal is to keep them open and keeping them moving forward. So that will be rolling out. You'll see more of that. We have some federal funding that we're going to allocate to implement this program. And again, I wish us the best. I thank the citizens of this community. It warms my heart to see us functioning. And it's showing in our sales tax numbers. And it's not just about sales tax numbers. Obviously, we need funds to keep things going. But it's quality of life. We spent 7 weeks with elective shutdown earlier. for the hospitals. I had a little procedure done this morning. If you shut down that affects 100% of our population, and nothing good comes out of that. So that's been our focus all along, is try to protect the ability of our healthcare system. And it's not just San Angelo and Tom Green County. There's 30-something counties in this region that absolutely depends on Shannon Health Systems for their health delivery. So that's crucial. We try to maintain that. So I hope that you will understand and you will support the efforts we're trying to do community-wide to try to get a handle on this and maintain the level of freedoms that we have now going forward. Thank you.
Dr. VRETIS and Dr. Barnett, would you like to come down and speak, please?
Good morning. I'll be fairly brief with my remarks. Everybody said it up to now. Keep doing what we keep been telling you to do all along. It hasn't changed. You know, stay away from people that are sick. If you're sick, stay home. Wear a mask, wash your hands, all the simple things that your mom taught you when you were a kid. That's what you got to do. That's how we'll beat this disease. We're right on that cusp between when we're going to be able to make it through okay and when we'll have a disaster. And we're right on that cusp right now. I don't want to see us fall over. You know, we're lucky that Shannon, when they took over the Southside community, were able to move patients now from the downtown campus to the Southside campus. This has really helped us decompress the downtown campus. As far as the fire department, we're changing our destination policy temporarily, so most of the medical patients that are not cardiac, neurologic, or COVID will be aimed towards the Southside campus, again in an attempt to decompress the downtown campus. If we get past the 15% and the governor says we need to start closing things down, I will hate it, but I will do it.
I just want to thank Dr. VRETIS. Of course, he's been a great physician on our Shannon team for many years, and I think now everyone in the community realizes what an asset he has been through this crisis. He didn't sign up for it, but he stepped up to the plate, and we're all very grateful for that. I'm not going to make any comments about masks because that's already been discussed, but I assume everybody is interested in what's going on at Shannon. And as Dr. VRETIS said, the timing of the acquisition of community could not have been more fortuitous for us. You know, this week has been a record-setting week in terms of COVID patients in our hospital, and a significant number of those also come through Shannon South through the emergency room. And we had the ability to take the strengths of both campuses, streamline each campus into what they were able to do best. Downtown, we're fortunate enough to have quite a few specialists, infectious disease, pulmonologists, critical care, a very adequate supply of PPE. So we made the decision to bring all the COVID-19 positive patients onto our campus. We have a large COVID unit which we developed over the surge in July. We learned a lot of lessons back then, and so it was quite easy for us to ramp up to the necessary number of patients available. Likewise, we took what community had. We streamlined what their units over there in order to take some of the medical patients from Shannon and put them over on that campus. Now we have, I think, optimum situation in both cases. Also, Shannon South or community has added a large amount of beds to our overall capacity. So, we're hoping and praying that, we don't hit a surge like they're having in El Paso or north of us. But if we do, we have now expanded our capacity significantly, and we will keep looking at what's the most efficient way to take care of these patients as they come in. As of today, we had this morning's report. We have a team. We have a team at Shannon. There's a call every day at 9 o'clock discussing every patient, where they came from, how they're doing, where they're going to go when they get out, the treatment, the latest treatment, any sort of new research that's come about, and just the overall strategy for the day. This morning there were 67 patients, all up in our COVID unit on the 6th floor, plus or including 13 or 14 patients in the intensive care unit. The intensive care unit, again, is stratified into a COVID side and a non-COVID side, so that's everything is kept completely separate. Testing, we have had to modify testing procedures for patients who are going from Shannon downtown to Shannon South and Shannon South coming to downtown, but we've had great cooperation with our new associates at that facility, and that's gone very smoothly. So at this point in time, we are, like I say, always optimistic that today's going to be the worst day that we've had, and if it gets worse, we will do what it takes to take care of these folks. And I think Judge Floyd and Dr. VRETIS have already said it very well, that, you used to read like, all our medical care workers were on the front lines, and, sort of I guess a military analogy, but really it's all of you folks and the people out in the community that are on the front lines. We're in the back. We're where people go. We're the MASH unit, back taking care of all the people who get sick. So, we're going to be just like, I don't know, most of you are probably old enough to remember MASH. You just take what comes in, do the best you can, and that's what we're going to do. But we greatly appreciate any help that anybody in the community, leadership, can give us in making it a situation that we can handle and take care of these folks in the way that they deserve to be cared for. Thank you.
Good morning. First, I want to thank the mayor and city council for hosting this united effort, and I've learned to let the general clean up behind me, so you're welcome to clean up any messes that I leave this morning. First, I just want to say that I want to highlight and thank our SAISD families for following mask procedures and protocols to keep our schools running. Our full intent is to keep the doors of the schoolhouse open. And we need our community's help and effort in doing that. I think some data that really correlates to the mayor's earlier remarks are that we have, out of about 12,000 students participating in in-person instruction, out of that 12,000, we have 1.5% of students that are positive or quarantined. So we are tracking very well with students. Over 98% are still in full attendance, but only about 1.5% have quarantine or positive out of that 12,000 students. So we're tracking well there. Like our city in general, we experienced the Halloween surge recently with positive testing, and it is becoming problematic with our teaching staff. As many of you may know that have had their own children in the school system or dabbled in public education, substitute teaching is very difficult to hire individuals, especially on Fridays. One of the mitigating measures that we've recently announced yesterday at about 4 p.m. was that we are going for grades 9 through 12 virtual Fridays. So we are piloting this only for 3 Fridays to see if this works: November 20th, December 4th, and December 11th. The goal in this initiative to go virtual Fridays, 9 through 12, obviously our high school students are more independent learners. They don't have childcare issues the majority of the time. But the goal is to push our substitutes down to the middle school and elementary level, because our fill rate last Friday was about 57%. So if you think about that, out of, let's say, 120 classrooms, if we have 60 classrooms without professionals or teachers in them, then it's problematic. So this mitigating effort is to push our substitute teachers down into the middle schools and elementary schools so that we can continue having our schools up and running. I think a piece of data that correlates to the mayor's remarks are that we have 98%, according to contact tracing in our great partnership with the CDC, 98% in that contact tracing, those traces have gone beyond the schoolhouse, and so that is not part of our organization. So we are doing well. I want to applaud our classroom teachers are doing an incredible job. Our families are doing an incredible job of following safety protocols in the school, because our quarantined or positive cases, 98%, are not happening in the school system. So school is still a safe place for students to attend. Obviously, that's good for multiple facets. That's great for learning. It's good for our economy. It's good for our first responders, and it is great for our parents that are involved in the medical profession, so that allows them to do what they do to help the entire city of San Angelo. So we have experienced that surge, and we are going to attempt to do our very best to limp along through Thanksgiving and the holiday season, keeping the doors to the schoolhouse open, because it's important to our economy and it's important to learning. We are still embedding a virtual platform, a virtual option for our families. So families that have wellness concerns for their individual families or children, we still have that virtual option for those families that still feel an increased area of safety and they want to operate virtually. So we're still doing that. Again, we have about 14,500 students in our system across the state of Texas. Some of my remarks at our previous board meeting, we have about 4 to 5% of students across the state of Texas basically are not in school. So if you think about that, I think I did a little calculation. That's maybe 215,000 students are unknown in the state of Texas. So what does that do to our workforce 20 years from now? What does that do to the efforts that we're making to keep kids in school? So any measures that our community can make, that our businesses can make, that our organizations can make to help us keep running, we applaud. And I just want to, again, thank our families for allowing us to serve their children and following our safety protocols. So thank you.
Thank you, Dr. Detloff.
Good morning. Thank you, Mayor Gunter, to give us the opportunity to Dr. Detloff's comments. I will tell you, mirror what is going on at the university here, your university here in San Angelo, Texas. Angelo State University has also been hit with the virus. We have numbers that mirror exactly what is going on in the independent school district right now, San Angelo Independent School District. And when we do the contact tracing of right now, the 116 people that are quarantined as a result of this number right here, 99% of them has been done from a community spread, is how we see that right now. And more importantly, as we have worked through this and looked at it, we still believe that we can make it to the 24th of November, which is the date that we will then close down the school for the holiday period of time through the 25th of January. Our numbers might seem high to someone, but when you look at how many people that we do have online, and we're still tracking them as well, all of those things play to the part that we believe that we can still remain open. However, What we have done is gone and eliminated any extracurricular activities that require you to be face-to-face. Everything has gone virtual, and we intend to close out with the virtual focus being there when we end up here, with the exception of we are going to allow the graduates to walk across the stage, receive their diploma, if you will, and then we will put that into a virtual graduation. And all of the graduates are not walking across the stage. We will do the social distance. There will be no family members there, and that will take place on the 24th of November at the Janelle Center. Other than that, everything is gone to a virtual setup, to include even our Christmas tree lighting and anything that would go on in the December timeframe, even after the students have departed the campus overall. We appreciate the work and efforts of Shannon in supporting us in all that has taken place here in the city of San Angelo, and the support of the businesses, the community, everybody that's tied to Angelo State. We appreciate all of your support in allowing us to be able to stay open and then, more importantly, deliver premier excellence in education, research, all that takes place at the university here at Angelo State. So thank you very much.
Good morning, and thank you, Mayor. Howard College, we're mirroring ASU and the SAISD. We've had a surge in the last 2 weeks, and we made the decision this week to offer our faculty the option to move their classes virtual for the next 2 weeks and through finals, so that we can stop this surge that we're happening. So we're doing that with many of our classes. The ones that are applied, we can't, but we are following those protocols, and we're doing a lot of contact tracing. The numbers were looking good, and then we think it's the Halloween surge also. So we also thank the community for the support we're getting. We're trying to stop this and doing everything we can as far as contact tracing and keeping our social distance, and we thank you.
Mayor, again, thank you for the opportunity, Judge Floyd. Thank you for the opportunity. Hey, I cannot get into the specifics numbers at Goodfellow, but unlike every other event that we've had on this, because this is not our first get together and first press conference, I will share with you that for the first time we actually have a significant number, and for the first time one of my pipelines has been affected. And let me tell you why that matters. Our North, just like everybody else in here, has been from the beginning the health and safety of our workforce. And in the case of Goodfellow, our workforce and our students, that hasn't changed. Goodfellow has remained fighting through this because the nation has asked us to do that. So our pipeline has remained open. Our pipeline has remained operational. Mission readiness is the key for us. But where we need a little bit of help from the community is for them to understand this, and I want to bring it up to a strategic level. I think Dr. DETHLOFF did a good job at this. The significance of having 215,000 students out of school today, 20 years from now. What does it mean for jobs? The significance of having a pipeline affected at Goodfellow Air Force Base, what does it mean to national security today? The fact is that our nation is looking inwards. Civil discordance, as well as dealing with this pandemic. The mission at Goodfellow Air Force Base is to actually develop and train those folks that are looking outward, the linguists, the crypto analysts, the fusion analysts that are trying to figure out what is it that China is doing, what is it that Russia is doing, what is it that Iran is doing. If I cannot graduate them, we will have an impact in national security, because they are the ones that are going to the units outside of Texas and in some places in Texas that are paying attention to that. So when we talk about mission readiness in terms of Goodfellow, I'm not only talking about the local aspect of it. I'm talking about mission readiness of our nation. So thank you for helping us trying to flatten this, this particular search. As I hear the comments, as I thought through this a little bit, we've been here before, and the city has shown that we can get past this. We've done it. I know that we can do it again, but we need to do it now. This is no longer about conversation. This is about action. This is about personal responsibility. Thank you.
Judge Floyd, I'd like you to come back up and reiterate some of your points and make sure everyone understands where the authority is today in terms of making decisions and what your intent is in terms of helping us stop the community spread.
Again, I'm glad to do that. Again, the authorities that we're operating under at this point in time rest solely with the county judge. Okay? The mayor's been great for public announcements, trying to encourage people. But in fact, it's the one at this point in time which I'm even somewhat limited under the governor's orders. One thing, again, that does not change is that if we exceed that hospitalization, then I lose any authority of this, and that is all subrogated back to the governor. The other thing that does not change is Dr. VRETIS's official duties and responsibilities under the local health authority. Actually, in a pandemic, under state law, he trumps the mayor and I. He has the ability to shut things down and control a lot of things. Been very good about it. Fortunately, we're all aligned in our wishes to see a fully functional community. And again, I can't think of any other place I would like to be dealing with the challenges that we're having right now with this room of community partners. We're all blessed to be here. And again, Colonel Nash said it. I think it's within our power to try to slow this thing down and maintain what we have going on here. But again, I need your help. This new program hopefully will provide a little bit of encouragement and assistance and remind people that it is within their hands, and maybe we can maintain the freedoms that we're enjoying right now. Because I don't want to be locked up during the winter when it's dark and cold and worried about not being able to get into a hospital. So, again, anybody has any complaints, comments, or whatever, please direct them to my office, because basically that's where this resides at this point in time. And I will reiterate exactly what I've just shared with you now is where we're at. And I won't be bashful about telling you my opinion. My opinion of these is not real high. But unfortunately, this is another line of defense that is very important to me. And again, if you just can't stand to wear one of these, try to avoid anywhere where you need to, out of respect for the other folks. Okay, it's as simple as that. You have a choice. If you don't want to wear it, stay out of where it's required, and that way you respect other people. And maybe with those kind of actions, we can continue to maintain the freedoms that we're enjoying here right now.
Let's open it up for questions right now. So, Judge, if you want to stay here for a moment, I'm sure. John? Yes, that microphone, please. Testing, can you hear him? Is the microphone on? Yeah. Maybe raise the microphone up a bit.
Thank you, Judge. John Tuff, San Angelo Standard-Times. You had mentioned that the county is going to hire compliance officers. How many compliance officers are going to be hired? Will they be identifiable? And you said that they're going to encourage people to make the right decisions. What does that look like? Do they get to assess fines? What
Sure,
kind of encouragement do they give?
I'll clarify that. Basically, what we're going to do is set up, much like we do a lot of other programs, basically off-duty officers that want to volunteer, and there's some of the federal funding that's basically for this type purposes, is to engage that. And basically they will it's really probably operate off complaints. We get a lot of complaints from citizens talking about certain events or businesses that they say that are out of compliance. Before, we really did not have anybody to have to go check on those. Currently under law, obviously the governor took out any detention of any of these folks. It's a fine only having to do with certain things. We're not there to do that. We're basically there to encourage them that whoever is in charge of that event is to make their citizens aware we're seeing this, and bottom line is the enforcement is the fact that Dr. VRETIS can shut down a business or event. That's the last thing we want to do. He stated that. But basically it's there to give those people some backup to where they can influence the people that are engaging in their events, whether they're customers or attendees or whatever. Is that, listen, hey, you're going to have to start complying or the event will get shut down. I'm asking for your help. So it's a persuasion with some pretty significant consequences at the end if that persuasion does not work. And then that decision basically rests with Dr. VRETIS, as it has since this thing started and exists today really in that form. It just, we get over that certain hospitalization, any discretion I have about requesting certain openings or closures or whatever, I'll lose that. That's subrogated back to the governor.
And how many compliance officers have been hired at this?
We don't know. We just hatched this up the last couple of days and decided to try to put it. It'll require a little MOU. I have to get it before in fact, I'm waiting until this afternoon to publish our agenda for Tuesday to present it to our Commissioners Court to allocate certain funds to set up this program, and the city has to do the same thing. It'll take us. We're going to put it on fast track because, again, I think we owe it to the community to try to do anything and everything that we can. Not only our community, again, to all our community partners, you've understood how critical some of those missions are. So if this is a step we can take, I'm willing to take it, and I think I have the support of the city pretty much, and hopefully we get the support of the citizens. So, you know, once we get it there, we're going to have it there as quickly as possible, and it's very simply about the mechanism to be able to pay them. We want a uniformed officer to be able to go in, and more than likely I can see them making some visits to some of the larger events that Dr. VRETIS and I have given permission, that have submitted their plans that says they will comply with the CDC guidelines and the sanitizers and the mask and the social distancing. We just want to see if in fact that's happening, and if it's not, encourage them to get their patrons to do that. And if that's unsuccessful, then Dr. VRETIS will have a decision to make how it goes forward from there.
Officials here have asked the community to take meaningful action to stop COVID-19. Is there what other actions are being planned prior to getting to that 15% threshold? Is there anything?
The one thing that has not changed through the course of this is the ability to control this does not rest with me or within my power as the county judge or the mayor or anybody in here. It's been a personal responsibility and a personal behavior. It has been from the very start. And it still remains that. We have not discussed anything else. Unfortunately, in my mind, if we're not able through some efforts such as this, is public awareness and a little encouragement through these compliance officers, as quickly as we're trending, very quickly it's going to be taken out of our hands. So I don't have any other magic wand in my back pocket to stop it. I don't think anybody does at this point in time. But again, the very basics we know is separation, some personal hygiene with your hands, and the mask has some effect. That has been consistent since this started back in the first part of March, and that personal behavior. So not much has changed. Our job is to give people the information, they can see the same information, and then take the steps that we can, that we think will influence that, and hope and pray that it does, because I think we have a very short window the way our trajectory is going, that we will lose the ability to do anything. That will then be taken care of out of Austin.
Can you comment on what that window is?
Again, anybody that's been, I've said several times, if I want 50 opinions, I ask 25 people about where this stuff's going. And as simple as that, I don't have that number. All I know is we watch trends, and we watch indices within those trends. It has to do with the amount of testing, the positivity rate, several things going on, pending labs. as indicators that correspond generally to future hospitalizations. In my mind, the only thing that's really saved our numbers from going up any farther the last couple of weeks is the fact that the under 40 demographic has been the highest trending upwards. And I think that's also indicative of what activities are going on out in the community. There, I think, are the smaller probability of needing to be hospitalized. And without that, I think our hospitalization numbers would probably be worse. But as you get more patients, as you strain the system more, as you put more stress on the care staff, the frontline staff that are having to deal with that. And then you start talking about things restricting visiting for our elderly that are in assisted living centers. We have been very blessed in this community that we have a number of people that are somewhat confined, whether they're in a nursing home, assisted living center, the county detention center, a male and a female residential treatment center, a juvenile justice center, that we haven't had any outbreaks there in our meat packing plants and that sort of thing. So we've been been very blessed, I think, in that. So it's broad-based where it's coming from. But again, hopefully we can influence some behaviors because we're all in it together. It certainly does not discriminate. It's not a respecter of man or woman where this stuff goes. And so I'm not going to make any predictions, but if our trajectory remains where it's at, if you just follow the numbers, unless it flattens off some, we are at great risk of crossing that threshold. And I believe Shannon is still attempting to get some additional beds certified within the system. And right now, we're still showing, as of yesterday, 556 available beds. You can do the math on 15% of that. And with 67 hospitalizations, you can realize how little room we have left. And then hopefully those additional beds will be certified, which will give us a little more room. But again, we'd rather not use up, all of that powder if we can keep from it. We just soon try to get this flattened out some. Yes.
I'm Joe Hyde with San Angelo Live. Judge Floyd, Dallas County Judge Clay Jenkins said that we should celebrate Thanksgiving playing the quiet game and not talk around the table. Obviously, if Halloween is being pointed to as being a super spreader event for the community of San Angelo, and we have Thanksgiving coming up in 2 weeks, what are your suggestions for Thanksgiving celebrations?
Well, I have not seen any data that specifically said Halloween was the super spreader. You've got to realize we have basically all of our education systems. Most businesses are open, bars, things. Thanksgiving is another event. Churches, we've had church fall festivals. I think it's very hard, and within the discussions we've had, Halloween was probably a contributor to it. But I don't know if it was any more than anything else. But again, the one thing is, I appreciate Judge Jenkins and his position on this, but you start stepping into people's living rooms as their families are celebrating Thanksgiving. I don't choose to go there. I'm not going to be welcome as the county judge or what I have to say. You just hope that those families, out of respect for their families enough, at least practice some safety protocols, especially if they're traveling from outside areas. I don't know where they could come from or where they could go to, that the community's not affected. Fortunately, as far as you look at the Panhandle and far West Texas, we're blessed and behind the curve. That's the reason I thank our citizens for it, because we've kind of held it at bay, but it's slowly moving this direction. So again, people, I don't think it's specifically the event. I think it's the people's actions, and if they have a respect for this and to realize even though they are not showing any signs at all, they potentially can be a spreader, and especially be respectful of those that are probably a little more susceptible to this. And so I'm not going to go into people's living rooms about Thanksgiving. It's no different if they go to Walmart or go to the bar. They're going to be around people. It doesn't make any difference if it's a family member or somebody you don't know. It can come from anywhere. So there's a lot of opinions out there, at this stage of this thing, people are frustrated. I understand. Those of us that live it basically 24 hours a day and have for 7, 8 months now, yes, fatigue sets in, but it doesn't change the fact that it's here. It doesn't change the fact that it can significantly affect a person's family, a business, or a mission if it gets, too prevalent within that. So, again, it's in people's personal hands. It's just from us to try to encourage them to follow the things that work, whatever event or an environment that they're in. We just assume all that stuff is able to go forward. Just be careful.
One more question for you, Judge. The enforcement, I guess, team that you're going to have, what is the fine? What are they going to fine you, and what are they going to fine you for?
It is, I don't know exactly what it's going to look like. It's not really there in enforcement. It's a compliance to there basically to put, to witness and to encourage who is sponsoring or controlling the event, to make announcements, try to get compliance. From there, I see basically that information will be relayed to Dr. VRETIS, who basically has the authority to shut down the event. Obviously, we can't detain anybody under the governor's orders. All along, I think they've been able to issue up to $200 fines for masks, but I don't think that's even happened in this community yet. That's not what we want to do. But effectively, those events or that business can get shut down. If you'll recall, there was one business that was shut down by Dr. VRETIS' orders for a period of 24 hours, and it was worked out that we determined with that particular situation was exactly what we're talking about now. There was a great safety plan. It's just that once people walked in the door, well, then that went in the trash and they went on about their way. And so there was some enforcement in-house on that. Dr. VRETIS allowed them to open back up, and we have not had an issue with that going forward. So that scenario is playing out today, and that's how we're going to try to approach it. The folks that are being responsible, we owe it to them to be able to keep on doing business and being responsible. I'm assuming that if somebody just can't get compliance, that Dr. VRETIS will make the decision to shut them down. I'll let him speak to that directly, because that is is at this time, has been and will be, remain in his discretion and his authority. I can request it, but I don't think I have the authority to shut it down.
I have one more question for Shannon. Obviously, since now our lever of control ends at 15% of hospitalizations being COVID patients. When we ask Shannon, your public affairs people, they'll just say we have plenty of hospital beds. They're not really specific. They say we can handle it. Obviously, we have the state of Texas on the Texas Department of Health and Human Services listing 556 beds. I believe that's the number. But we've been told that can change. So if our denominator changes, what really constitutes 15%? So can you kind of just give us a picture of the available hospital beds, and at what number of hospitalizations is it really going to be 15%? And that's all I have. I'll sit down.
That's a little bit complex, Joe. The 557 is our regional trauma service area, I believe. So that includes all the hospitals in 25 counties and their beds and various calculations therein. I can only speak to Shannon, where actually the 15% is not really a number we're focused on at all. I mean, we're just focused on our census, adding additional staffing and beds as the COVID patients arrive. That 15% of that regional trauma service area really is not 15% of our beds, or really doesn't figure into how we plan our capacity issues. Like I say, we have 67 people today. I don't know what percent that is of anything. I just know, our trauma, our COVID unit is designed to kind of have a sliding wall, which we used back in July, so we can increase the size significantly above that or decrease it below that. It's a lot of moving parts, and now with the South Campus, it's quite complex how we're, and it's a good opportunity to be able to utilize, ICU beds on both sides of town, beds that have previously not been utilized in some time. Sometimes we all forget, we have St. John's campus that has a large number of beds that are currently being used for more rehab type uses that we would consider available if needed. So I don't know if that answers your question. Again, the 15% doesn't really figure into our.
Your question is, the number of beds, y'all control 90% of the San Diego market or whatever it is, and we're only talking about Brady and Fletcher County as hospitals and trauma service care. It seems like the number of beds is a fluid number. Like you can say, well, Shannon has 500 beds. Well, we can stand up another 600 beds. Second to that, in Midland, like when you talk to Midland healthcare providers, they'll talk about, well, we have a constraint based on personnel, how many nurses we have, how many doctors, how many healthcare providers we have. So if we're going to be told we're going to shut down at 15%, I just think the people ought to know roughly what that number is, and is this going to be a moving target, moving the goalpost kind of thing?
Let me just make a comment, and Dr. Barnett can finish up with it. But today, if you talk about COVID-19 patients as a 15%, the hospital's ability to be fluid also depends on how full the hospital is with flu patients, other patients, et cetera. So when they say it's a sliding door, it is, because today they might have plenty of beds, but if 2 weeks from today there's a big flu outbreak and hospital beds are given to the flu, then again, it changes the dynamics. And so where they can be fluid, they want to be fluid. That's in their hands right now. It might not always be in their hands to be fluid because of other hospital beds being used for other reasons.
As far as the authorities within me, it's very easy for anybody to track it. Everybody has seen the DHHS dashboard. Down below that has hospital data, and if you click on that, then you can go by region, and that's where we're Region K. And if you go to TABC's website, which is actually where I sent my attestation form for the bars to open up, and also under that order allows the restaurants to go to 75%. They have that listed there, and that's what they're going to be watching. And so it's still at 556, I believe, and then it'll be fluid somewhat between the patients, depending on what gets reported. But that is going to be the directive that's going to end up with me. And actually, as I say, underneath that authority for us to open, it's incumbent upon me to notify them if that changes and we go over the 15%. Now, officially, what number I would use to invoke that mandate underneath that, well, then I would depend on, obviously, what the hospitals in this region tell me. But again, anybody can track that. It's up there 24/7. But again, the DHHS dashboard where it's got all the total tests and all that, a little blue link down in that says hospital data, and you go to the region and you can track that. And the little screen for Trauma Region K is the same one that if you go to Texas Alcohol and Beverage Commission that they are tracking.
Yo les voy a hablar en español y quiero que me echen la manita, ¿sí? Honorable juez. Ok. Esto es para todos los servidores, todos los directivos de universidad. Honorable alcaldesa, honorable juez, a todos los compañeros medios de difusión. Ya se ha hablado, o sea, todas las personas han hablado del problema del coronavirus, del COVID-19. Y ahorita que ya estamos a través del servicio informativo en español, lo estoy haciendo en español porque la gente que me oye habla español y eso es lo que está haciendo falta, de que los medios, todo lo que pasa aquí, hagan la traducción también en español o en otro idioma. La responsabilidad está en las manos de todos ustedes, de los del concilio y todas las personas que nos representan. Por eso, cuando se habla de cifras, cuando se dice que hay muchas personas infectadas del coronavirus, nosotros les decimos en nuestros noticieros del servicio informativo en español y los medios a los que nos copian la nota, les decimos, es muy importante seguir las indicaciones de el control y prevención de enfermedades de los Estados Unidos. Ahí están las personas que saben lo que está pasando.
You mind if I,
Okay.
me permite traducir? He started out thanking each of the members of the panel, as well as the commission and the county. He made a point about potentially adding a translation service to the Hispanic community so it can go to a broader audience. And he is now making a statement about encouraging his population through everything that has been said in here to follow personal responsibility protocols as well as CDC guidance. Y vamos entonces, como un minutito, entonces me deja traducir para...
Sí,
para
gracias,
empezar.
sí, le agradezco mucho. Es que parecía que ya estaba, es que estaba saliendo la noticia, pero ya, ahora sí vamos calmados. Hemos buscado a través de las personas encargadas, como el director del hospital Shannon, que ahora también Community es Shannon, de hablar que hay un 50% de camas disponibles, la mía está grabando, pero eso no resuelve la situación. Lo que se necesita es que la alcaldesa, honorable juez, y las autoridades hagan lo que dijo el gobernador Greg Abbott, enforzar el uso de las mascarillas, guardar la distancia y evitar las grandes reuniones, cosa que muchas veces no se está haciendo, y les voy a decir por qué.
Okay, me permite. Okay, what he did is he made a statement about the numbers from Shannon, but he is now making a statement about how the message that has been given here, sort of like Buttress, is complemented by the governor's message, by Governor Abbott's message of wearing a mask, of social distancing and general hygiene.
Si no logramos que las autoridades enforcen una ley, pero enforzada a todos, que multen fuertemente a una persona que no use la mascarilla, a una persona que no guarde la distancia y a una persona que se mantenga en reuniones haciendo fiestas, propagando más el coronavirus. Les voy a decir esto.
Voy a traducir esto, pero tiene una pregunta para entonces dejarle saber.
Sí, ya voy a terminar.
Okay, so here's what I did. I'm going to translate what he just said, but then I also asked him if he had a question so that you can provide our perspective. So what the last statement he made was that we need the authorities to actually enforce and actually fine people that are not abiding by CDC guidance.
Sí, sería muy importante, honorable juez, porque ahí en este barco vamos todos.
That would be very important because we are all in this ship together.
And I agree, and I think you are correct. We don't want anything lost in translation, whatever language it is, however we can solve that issue, because we need everybody on board. And again, It has been a confused line about forcing personal compliance with things. Obviously, everybody remembers during the course of this, the governor changed enforcement techniques over a hair salon in Dallas. And again, we would much rather, I've found over through the years, it's a whole lot easier to get people through encouragement and show them the benefits of complying than trying to enforce it with something having to do with a fine or something. But again, I think the penalty is that whatever event they're choosing or whatever business they're choosing could potentially be shut down without that compliance. That hopefully is all that we need. I have no desire to see anyone personally. I just as soon, again, if they do not want to comply, they hate a mask, is stay out of environments where they are required to. And there's a lot of places you're not required to wear one.
Pues el presidente Donald Trump dijo que no usáramos la máscara y le dio el coronavirus, pero él sí tiene doctores que le paguen la enfermedad. ¿A quién le vamos a hacer caso, honorable juez?
Who should we listen to?
Come on, the president's got a little bit of medical team. We got Shannon Health System, so the president just wishes he'd have the health delivery system that we have.
No, pues yo sé.
No, you have brought some very important points, is that we want everybody to understand, because again, it's affecting the Hispanic community, the black community, white. It makes no difference. It's not a respecter of people. But again, it's going to be difficult to detain and hold people absolutely personally responsible. I think that is unobtainable. We just want them to see the value for them and their family in it by complying.
Muchas gracias. Thank you very much. Arturo Madrid, Servicio Informativo en Español.
Caleb Wallace, San Angelo Freedom Defenders. Been bombarding y'all with emails, and I hope one day you'll actually respond to one of my emails. You said you'd be glad to respond. I hope one day your office will actually respond to it. I wanted to reach out to Shannon. PCR test, what are the count thresholds Shannon is using? I've asked Shannon directly 6 times what count thresholds are you using. I've asked Dr. VRETIS, the city, but we're calculating all this information to shut the city down or to enforce these restrictions on citizens without this knowledge, without this data. So can we get an answer for that? PCR
Repeat
test.
that.
What count thresholds is Shannon Hospital using?
Thresholds. I'm not aware of account thresholds that we use on a PCR test.
That's how you calculate your PCR test.
Sir?
That's how you calculate your PCR test.
I understand.
So the CDC recommended back before April, Dr. Fauci said anything over 28 should be discarded as a false positive. What is Shannon Hospital using? What threshold?
I would have to consult with our lab. We use a national PCR test, but I don't know the answer to that.
Yeah, see, I've contacted Lindy Stone, the spokesperson, and I get the runaround saying, well, we could follow the guidelines, manufacturer guidelines. So is Shannon withholding this information, or is this just not really available? Because the reason why PCR tests are so important, the rapid tests, because if you're detecting something that's already dead, anything above 28, we're detecting dead cells. So we're getting false positives. You heard the CDC came out a couple months ago about the 92% false positives. So we're leveling this kind of tyranny upon citizens without this data. So does a PCR test mean you're infected? Does a PCR test mean you're contagious or you're sick?
Yeah, that's a great question. I can tell you our experience with the PCR test. So if you're exposed and you develop symptoms and the PCR test is positive within a few days, let's say within 5 days of that, it is extremely accurate and very sensitive. So there's a high likelihood that you do have coronavirus. However, after day 7 or so, you have RNA particles in your respiratory tract that will show positive on the test because it's very sensitive for approximately 3 months. So initially, we retested lots of folks over and over and found that they were continuously positive. They're not contagious.
SpaceX just announced today, Elon Musk, the owner, said he sent 4 tests out. 2 have come back positive, 2 have come back negative. Here in San Angelo, I work with people who have had their family go in twice and get different results within a week. We've had people here in San Angelo get calls when they're sitting in line with these long, right when we first started all this drive-through rapid test stuff, filled out the paperwork, had to go for a meeting for the family. The line was too long. Got a call from Shannon Hospital, said they're positive. They're going to put a sign on your door. So where's the accountability? Who's putting checks and balances on Shannon Hospital with the data collection? Because at the 9 a.m. phone calls you guys talk about every day, the citizens are involved. We don't get a say. Who's putting the checks and balances? Who is Shannon reporting to? So my question is,
Go ahead.
My question is this kind of tyranny without the data to prove as such worth it? Mayor Gunter, to be just a statement, I'm quite disappointed with your reaction to this. You know, we talk about, and Mr. Chief Floyd, we talk about how these socialist ideas are coming from California. I can't tell the difference between you or Governor Newsom. I can't tell the difference. I can't tell the difference if I have freedom to breathe free air or breathe it sucking air behind this thing. So I have a challenge to each of you to actually live up to the standards that we elected you to do, is to represent us, be accountable to us, and protect our freedoms. My health has nothing to do with you. It's not my job for your health. As harsh as that sounds, but our constitutional fundamental rights protect that. Nothing else. I'm sorry that comes off as blunt, that I don't care. I do care. I care more about freedom than I care about your personal health.
Do we have any further questions or comments that anyone would like to make today? If not, that concludes this press conference, and thank you all for coming and attending.